skin irritation or rashes from your faja or bandages. I don't see that very often from a faja. What we do see more commonly, is what I see, is if somebody's using bandages or band-aids and it's the adhesive that's on the band-aid that actually will cause a contact dermatitis. And that's where you get a very limited area of redness that relates to where that bandage or that adhesive or the tape was applied. It's not serious. You just have to stop using the adhesive, you stop using the bandage, and you can use a topical steroid. Sometimes we'll recommend to patients to do that. Just something over the counter they don't need a prescription for, and that will help that. It typically is itchy, and it usually resolves within a few days. There is another rash that I have seen, and that's actually from what we call the prep or the skin prep, and typically we use Hibiclens. And some patients, once in a while, you'll see they will develop a rash exactly where you've done the skin prep. So for example, if somebody has a breast augmentation, we will clean them from right under their chin all the way down their whole chest, upper chest, their breast, all the way down to their belly button, their armpits, and halfway down the arm. We want that whole area to be cleansed and to be sterile before we're doing a breast surgery. And sometimes you'll see somebody after surgery and it looks like they're wearing a Hibiclens t-shirt because everything's from here all the way down, and wherever you stop, that's totally fine here, and they have a rash here. Again, that's usually self-limiting, some topical hydrocortisone that can then fix it. But it's usually the adhesives, and that's why I don't recommend patients use any tape when applying things. So if you have to have a bandage over an incision because you've had liposuction and that fluid's leaking out, I think it's much better just to put some gauze on the skin, cover it with an ABD pad, which is our thicker absorbent pads, and wear that under your faja. And use the faja to keep your bandage in place rather than using any tape, which can have an adhesive, and that can create a problem, particularly to sensitive skin after surgery.